Hey, so my name is Chris, and thank you for tuning in again. The paper I'm going to be talking about is Phage Therapy Revitalized, and this is a Nature paper written by Sarah Reardon, and this is in 2014 in Nature. And what this paper is talking about. So, back up to like what we're currently dealing with right now in society. So, we have a lot of antibiotic resistant bacteria out there. And this is because we've been over prescribing antibiotics. People are not strict on staying to their regimen for taking the antibiotics. So what's happened over time is we've slowly gotten antibiotic resistance bacteria. Examples of this, well, E. coli is one, Salmonella is one. You have vancomycin resistant Enterococcus, MRSA, Clostridium difficile, so you just have a bunch of different ones that are coming through. MRSA is probably the most common one that you guys know of, but so these are like all superbugs. So what's happening right now? So the only way to kill these superbugs are with stronger antibiotics or like alternative methods. And I'm sure there's plenty of alternative methods out there, but this paper is focusing on one specifically called phage therapy. So, and I think it's a little bit more promising as well because using phage therapy is like completely different than antibiotics. Antibiotics have to target either certain markers on bacteria that are unique, or it attacks it at certain stages of their life cycle. So now we're looking at this. So we're gonna try and do phage therapy to kill these bacteria. And what is a phage? A phage is a simple name for a bacteriophage, and a bacteriophage is a virus, a bacteria eater. So they have all these bacteriophages, and what they are doing in this paper is they're doing a study in Switzerland called the Phagoburn study. And the Phagoburn study gets its name from the fact that its samples that it's using, like the people that it's using, are burn victims. And burn victims are very common, like you lose your skin barrier, which means you're very susceptible to having bacterial infections. So it's unfortunate for the burn victims, but it's really good for this study because now we can use these phage cocktails, which I'll explain in a little bit, to then try and attack these drug-resistant strains of bacteria. Now, what a phage cocktail is it's a mix, just like a regular cocktail is like a mix of a bunch of different alcohols or solutions. A phage cocktail is a mix of a bunch of different phages. And phages can attack different bacteria based off of tropic factors like presence of LPS or other receptors or stuff like this on the surface. So the phages will uniquely attack only certain types of bacteria. So this Phagoburn study was started in 2013, and what it's looking at is a possible efficacy to treat drug-resistant bacteria without having to incorporate antibiotics. Now, of course, these patients are all guaranteed antibiotics if the phage treatment doesn't work. But now shifting over to the United States, the U.S. and this is all Eastern Europe. This is phage therapy stuff. The U.S. doesn't really believe in this, partly because it was a lot easier to create antibiotics and easier to grow, easier to utilize. So we have a very antibiotic-based society for Western United States. And one of the issues is now if they want to try and reintroduce this phage therapy, there's this patentable information. So intellectual property is a huge issue in the United States, and if you try and patent phage therapy, it's been around for hundreds of years, so you won't get that patent. You won't be able to make money, and that's what the United States runs on, unfortunately. So phage therapy is probably going to be hindered a lot. That being said, though, I think it's people at MIT. Yeah, people at MIT are researching a certain phage, genetically engineered, so then you'd be able to patent it. It would be intellectual property because you created the phage. But so the phage will then be able to kill antibiotic resistance bacteria by almost scanning the bacteria that it infects. And if the bacteria that it infects has a certain gene sequence that's representative of a certain drug resistance, then it'll attach to it in this thing called Cre9, will then come and just kill off the entire cell. So it's selectively killing cells. And they have shown this to work really well in their first studies, which were waxworms. And they did a great job. They 99% success of killing off the drug-resistant bacteria. And now they're stepping up to mice. So now they're going to be testing it in mice, and probably this very second on, what is it, May 18th, 2015. They're currently testing it right now. And probably maybe 2020, 2018, when they actually start human trials. So we can definitely see a really, an increase in phage therapy being more visible in society, being more used, being more accepted. But as of right now, this paper is just talking about just the start, get the ball rolling on phage therapy. So, yeah, once again, this is Phage Therapy Gets Revitalized in Nature, volume 510. Thanks.